We're here with Medical Director of the Orthopedic Center at the Miller's Children's and Women's Hospital, Dr. Torin Cunningham. Thank you so much for joining us. How are you?
Doing well, thank you.
So you have a couple of really interesting advanced machines that are right here, and actually it's the only hospital in California that has them at the moment. Talk to us about this Eos Imagining System that you have.
So the EOS is a standing X-ray machine that we can do front and side imaging simultaneously, unlike standard X-ray where we can get one plane of the body at a time. The advantage of this is that by doing both of these images simultaneously, we can take that data, run it in through a computer, and if we need to, get almost 3D quality imaging reconstruction out of it. So for things like complex spinal deformity, we can almost recreate a standing CT scan of the patient's body and kind of figure out planning-wise where we want to do a lot of our corrective techniques and things like surgery. Same can be applied for leg deformities. When somebody's got an angular deformity in the leg or a short leg, we can use the EOS to plan for that and kind of account for that surgery. So the technology itself is great for the 3D reconstruction capabilities, but the added benefit is it has significantly less radiation exposure to the patient compared to conventional radiography or even digital radiography. And so a lot of these patients I might see at an early age, especially for somebody with a congenital spinal deformity as young as 1 or less, and I might have to follow them all the way until almost adulthood. And so over that time they may have numerous X-rays, and so decreasing that overall exposure dose to them certainly is beneficial in terms of reducing cancer risk or concerns like that.
Talk us through a little bit about the procedure of the system, as in when you do have a patient coming in, and then how does it actually work when they come in, they are scanned, how long is the scan, and what is the result of it? How does it help you as a doctor to be able to see what the result of the scan is?
So the scan itself is actually surprisingly fast because both of those X-rays are done simultaneously. So the machine itself, they kind of stand within the center of the machine, and the X-ray beams are sliding down top to bottom at the same time to acquire the image. So we can do a full body head to toe scan in about 15 seconds. We can funnel the view to just the spine, just the legs, so you can adjust that to the parameters you're looking for, but the entire picture can be done over the full length of the patient's body if we need to.
Now you also have another really interesting technology that's just come out, the Excelsiors technology that uses a robotic arm. This sounds really advanced. Do explain to us why this machine is so unique.
So it's the Excelsiors GPS Robot. It's made by Globus Medical Technologies. Basically, what the Excelsiors lets us do is when we're doing these spinal deformity corrections, we're putting screws into each of the individual vertebrae so that we can bring those to rods to straighten up the spine, correct any rotational deformity that's there. And so that one of the most challenging parts of these surgeries is safely putting in these screws because they're going in directly on either side of the spinal cord and the nerves coming off of the spine. So it really requires fine precision in terms of the placements of them. Traditionally, we've done those basically freehand, where we identify where the screw should be and we go by field to put those in. This technology basically allows us to get a CT scan of the patient, map that to X-rays obtained during the surgery, and then we plot trajectories of where those screws would go before we even proceed with the operation, so we know exactly where each of them should be. The robot then positions the arm directly over the patient where that trajectory line would line up, and we can drill and safely put all the screws in through that tube with pinpoint accuracy. So we've done a handful of cases already with great success with the robot. And we have also what's called an O-arm, which is a different imaging technology that's effectively like a CT scan in surgery. So we can run the robot, put our screws, we bring in the O-arm, and we can confirm that each of these screws is where we would like. And we've been very happy with the accuracy when using the robot. So it's another safety means, and again, this is always one of the challenges with any kind of spinal surgery is how do you do it safely, minimize the risk of any kind of neurologic injury, and the Excelsiors is an added tool to provide maximum patient safety.
Well, that's really incredible that MemorialCare has these two technologies, that you're able to make use of them.
Certainly for us, this is something we've pushed for a long time as we've continued to expand our spinal deformity program here at Miller Children's, and again, optimizing patient safety, both from the radiation exposure perspective with the EOS, and then the intraoperative safety with the robot have been big advances that we've had.
Well, thank you so much for clarifying that, Dr. Turin Cunningham. It's been a pleasure talking to you as well.
Thank you so much.